Today, future nurses, I'm touching on information technology system applicable in nursing practice. So in this unit or chapter, you will learn about some technologies that are used in the clinical setting. Your goal is to understand what is the purpose of each of these equipment that I will be mentioning, or each of the system that I will be mentioning. So if you have questions, you let me know later on so that I will be able to augment based also on what I know. Now, I just would like to have some disclaimer that the photograph used in this slide belongs to their respective owners. Now, they are not actually my pictures. I've grabbed them from the internet. I tried to grab pictures that are used in the practice more frequently so that I will be able to discuss this topic. There is no intended, this is not an intended endorsement of the brands. So please do not construe that if I'm posting a certain brand, I am proposing to use that brand. Okay, that is just for the purpose only of discussion. So I hope that in this chapter, we will be able to describe the information technology applicable in our practice and then explain the application of nursing informatics in community health practice. We will be able to learn that later on, especially that we are moving towards the primary healthcare, the universal healthcare. Prior to that, let's talk about your hospital and critical care applications. Now, guys, when we talk about the hospital, so I hope that you already start to imagine what the hospital is now. If you have been already in the hospital, I hope you already have the picture of what are the components of a hospital. So for your hospital, my dear students, there would be usually a nursing department, and then there are ancillary services. And then other than that, of course, you have your medical services that is for your doctors. Now, for your nursing department, we usually divide our nursing department to several. So you have your emergency department for that matter. Okay, you have your emergency as an example. You have your ORDR, your operating room and your delivery room. You also have your wards. In other hospitals, they refer to that as their patient care units. Now they refer to their wards as their patient care units. Then you also have your dialysis for some hospitals. For some hospitals, you have your chemotherapy unit. And then for other hospitals, you also have plus your ICU. You also have your CCU. You also have your other hospitals here, for example, in Iloilo, would have the stroke unit. So when I say class ICU, your ICU is intensive care unit. When I say class CCU, that's your critical care unit. They are mostly synonymous, no? But in big hospitals, they are separated. Then class you have your ACSU. Your ACSU usually stands for acute stroke unit. In other hospitals, all of these areas are accommodated under ICU. But in more specialized hospitals, they are separated into three. Okay? So when I talk about the wards naman, depending on how big your hospital is, your wards may be divided into medical ward. You also have your surgical ward. You also have your OB ward. You also have your pedia ward. Okay? In bigger hospitals, for example, they have a ward for cancer. They have a ward for infectious diseases. Right now, most of the hospitals have a ward for COVID because of the pandemic, of course. And there are more specialty wards, no, depending on how big your hospital is. But the point there, class, is that we group patients based on their needs. No? So in other hospitals, you will even encounter female medical ward, male medical ward, female surgical ward, and the like. So why am I talking about those parts of the hospital? Because here, as you can see on the slides, we will be learning about critical care applications. So when I say class critical care applications, those are patients who are admitted in your intensive care, in your critical care unit, your ACSU unit, and any other care for high acuity patients. Okay, class, we use the term high acuity patients. When I say, my dear students, high acuity, ang ibig sabihin yan is that these are patients needing more care, these are patients needing more attention, or they are patients also class that need more nursing hours. Kung baga, kailangan nila ng close monitoring, kailangan talaga nila class ng intensive care so that their condition would be relieved in the hospital setting. So that's why it's being referred to as critical care units. Now, what are the patient care uses of your information technology? So students, with those various departments that I've mentioned, your information technology processes, store, and integrate physiological and diagnostic information. So look at the words physiologic and diagnostic information. Plus, what the system does is to integrate all of them so that we will be able to learn from those physiological and diagnostic information. It presents deviations. Plus, when we say deviations, we oftentimes refer to this layman term for your deviations are your abnormality. So it presents plus your deviations from preset ranges by an alarm or alert. So if you have been in the hospital setting, you will notice class that most of the machines in the hospital would have their alarm. And that alarm system class is an indication that something is out of normal. Something class is out of normal. That's why the system would alarm. And one of the purpose also is to accept and store patient care documentation in a lifetime clinical repository. So class, right now, with the advancement of your information technology, dati-rate, yung mga hard copy class ng documents natin, di ba may patient's chart tayo? Plus the hard copy of the patient's document may be disposed within 5 years. Okay? 5 to 10 years. That's the guideline given by the Department of Health. So kapag hard copy, for example, 5 to 10 years class, pwede na po siya nating i-dispose. Okay? That's what happens, no? Pag hard copy siya. Now, the next thing class is that if medical legal case siya, kindly take note, the exception pa na ito. Pag medical legal case siya, the document needs to be stored for 25 years. Okay? For 25 years or even more. So what do we mean by medical legal case? For example, if it's a document that involves a patient who is involved in a crime, if it involves gunshot wounds, if it involves mauling, so anything class na may legal implications, they are being held in the hospital for 25 years, yung documents. Pero with the advent of your information technology, look at the term being used right now, lifetime clinical repository. So bakit siya naging lifetime class? Because we are already able to keep the documents without the need for the physical space in the hospital setting. Okay? Hindi na masyadong malaki physical space na na-occupy ng documents natin because they are already soft copies, supposedly. Okay? Supposedly. Okay, now, if you would look at this graph that I have or diagram that I have derived from the internet, so class, nakikita po natin that from the patient, there is this acquisition device. So when we talk about the acquisition device, it could be a probe, no, it could be a probe, it could be an instrument, it could be invasive, it could be non-invasive. Class, if I am inserting that device to the body of the patient, is that considered invasive or non-invasive? Yes. Pag pinasok ko yung device sa katawan ng patient, invasive ba yan or non-invasive? Students? Yes, yes. I would want to see your answers, future nurses. Pinasok ko sa katawan, is that an invasive procedure or a non-invasive procedure?
Invasive, sir.
Okay, it's considered to be an invasive procedure, di ba? Obviously, sa term, ano? Now, bakit ko naman ini-emphasize yung invasive procedure? Once class we will do something invasive to the patient, what particular document first do I need to check prior class to doing or assisting in an invasive procedure that will be done to the patient? Anong document yung dapat ko muna i-check, dapat muna nating i-ensure na nandyan bago po natin magawa yung isang invasive procedure? Anybody? Sige na. What particular document needs to be signed by the patient, should have been explained by the doctor to the patient, signed by the patient before any invasive procedure is being done?
Consent, sir.
Okay, class, consent, no? Consent. Okay? Bakit ko naman nire-remind yan? Sometimes very excited tayo to use the technology. Sometimes we say that this technology would be able to help the patient, but at the end of the day, was consent given by the patient or the immediate family members is one important thing. Okay? It's our legal obligation as nurses to ensure that there is always consent. Now, despite the fact that we are talking here about machines in NI, in nursing informatics, there are machines class wherein the probe needs to be inserted towards the patient's body, inside the patient's body even. So class, when that happens, you as a nurse should ensure that there is consent. I'll give you an example. There's a particular test being referred to as electromyography. Okay, there's a particular test that is being referred to as electromyography. Plus your EMG, we refer to this one as EMG. Your EMG is actually a test that would elicit the responses of our muscles, as the term implies electromyography. So class, pag sinabi kong myo, di ba, myo should refer to your muscles. Okay, that's one clue that you have. It's muscles. Now class, look at how the procedure is done. As shown there on the image, my dear students, a needle is being inserted towards the muscle of your patient. Actually, several needles class will be inserted towards the muscles of your patient for the doctor, for the physician to determine whether that muscle is still reactive or not. Okay, if that muscle reacts to signal or not. So class, you have the term electromyography. So even though it is a simple procedure, needle class will be inserted towards the patient's body. You need to ensure that the patient has consent before you bring that patient to the area. Okay? Kadalasan kasi tayong mga nurses sasabihin, oy, for EMG yung patient natin, mamayang 10 a.m. So anong gagawin natin? We bring the patient to the EMG room. Plus, before you do that as a nurse, you need to check that there's a consent. Okay? Now, going back to my point here. Now, from the patient, class, take note that there is an acquisition device. That acquisition device could be any machine, could be any equipment, as I've mentioned, could be done invasively. It could also be done non-invasively. Now, from those acquisition devices, class, multiple data, such as your vital signs, are being taken in a time series manner. Ibig sabihin, class, tuloy-tuloy, kumukuha siya ng information, kumukuha siya ng data. Once that data class is being collected, transmission will be done in your LAN. Diba? In your computer, you're learning about your LAN. Your LAN class is your local area network. When I talk about the local area network, my dear students, is that only a network in our hospital, or is that a network that could be accessed by anybody globally? Pag sinabi nating local area network sa hospital natin, hospital lang ba yan, or could it be accessed by anybody in the web? Yes. Okay? So class, pag sinabi nating local area network, yes, tama yan, Nicole. It refers to your hospital only. Okay, yan po yung LAN natin. Now, since we've mentioned about this class, pag LAN po natin, usually it's considered to be minimal risk. Okay? Minimal risk siya because it's only in the hospital. So kumbaga, ma-access lang ang data if your system would be hacked. However, class, if it is the global area network, no, if it is the World Wide Web already that we are talking about, we need to ensure that the data is secured and additional layers of protection are actually being placed to ensure that the data would not be accessed by anybody illegally. Okay? Now, once class na sa local area network na siya natin, pupunta siya sa storage, pupunta siya sa vital signs database, and with machine learning class, no, it has the feature of extracting it, classifying it, forecasting it. Extraction class, ibig sabihin ma-extract yung significant information. Classify class, ika-classify niya kung normal nga ba or abnormal. And forecasting class, it will be able to predict what would happen next. Okay, that's why class papunta siya sa tinatawag nating prediction outcome. And from that, your medical staff will be able to receive the information. Okay? Sir, napaka-complex naman. Actually, class, yung nakikita natin in the actual setting lang naman, okay? Ang nakikita natin in the actual setting is this. Yung patient, papunta kay machine, tapos tayo kaagad binabasa natin kung ano yung nandyan sa machine. Now, Why is it that we are learning this part? Sir, sabi mo yan lang naman yung nakikita in the clinical setting. Why do we need to learn this part here? Class, it is for us to understand that if may nagkakamali sa information na na-receive natin, there might be something wrong in these areas. Okay? For example, if I requested for the complete blood count of the patient, and then after 2 hours, wala pa rin. After 4 hours, wala pa rin. I would know that, oops, baka may nagkamali doon sa local area network. Baka class sa storage nagka-problema. Or baka naman dito sa machine learning natin pumalya. So that I will know if who will be the people that I need to call to. Okay? For example, what happened with me in the hospital is that I requested a supply for the patient, and then I expect that the supply will be available for 30 minutes. However, I got busy with my other patients' class, hindi dumating yung supplies ko. And then it was later on that I found out that the central supply department was not informed of my request via the computer. So sino yung tinawagan ko to troubleshoot? I called our information technology department so that the IT department will be able to check if what happened to that request. Okay? So yan yung important concept na gusto nating malaman. Ano po yung mga possible uses po ng ating information technology in patient care? Another class is that it will be able to trend data in a graphical presentation. So what does a graphical presentation offer us? A graphical presentation allows us to detect deviations early. It allows us to detect deviations or variances early. So look at this, you are actually looking at the graph being made by a hospital information system class. Okay? And if you would look at the graph, this is just a graph of your vital signs. So ano po yung nakikita natin? Nakikita natin na 130/90 yung BP niya. Dito naman nakikita ko 140+/100+ yung BP niya. Dito naman class almost 150/115. So that in itself, I will be able to see that this is the trend of the patient's BP. And I will be able to know what happened here. Why is the BP elevated in these hours? Tapos, sir, bakit po kailangan may color from top to bottom? Plus, that actually tells you what is the pulse pressure of your patient. That actually tells you the pulse pressure of your patient. Now, if you can recall in your fundamentals and your health assessment, what's the formula for the pulse pressure? Future nurses, what's the formula for your pulse pressure? Anybody? How do I solve for the pulse pressure? Halimbawa, isosolve ko yan manually. What's the formula class that we use for the pulse pressure? Anybody? Okay, may moment of silence po tayo. Sige na. Ano yung formula, guys, for pulse pressure? Okay? Guys, the formula for your pulse pressure is systolic blood pressure minus your diastolic blood pressure. That's the formula for your pulse pressure. Okay? Now, let's pick it as an example. Class, if the BP of my patient is 120/80, what's the pulse pressure? If the BP of my patient is 120/80, what's the pulse pressure?
40, sir.
40, sir.
Okay, so in this case, class, the pulse pressure would be 40. Okay? 120/80 class is considered to be normal, di ba? Considered siya natin class as normal. So class, ano po yung normal blood pressure? Ano po yung normal pulse pressure natin? Class, the normal pulse pressure is playing between 30 to 40 millimeter mercury. 30 to 40 millimeter mercury. Bigyan ko kayo ng example. Class 90/70. What's the pulse pressure?
20, sir.
Okay, pulse pressure is 20. Is it normal or not?
Not, sir.
Hindi na po siya normal, no? For example, if I am dealing class with a patient with dengue, your narrow pulse pressure is actually a signal that your patient may be actually bleeding already. Okay? It's a signal that your patient may be bleeding already. Later on in MS, you will understand class that if it's a widened pulse pressure naman, for example, na greater than 40 siya, it might signal class that there is an increase of your intracranial pressure. It will signal, it signals that there is an increase of your intracranial pressure. As you learn more diseases, you would understand class that there are more implications to that. Hindi lang po yan yung mga implications niya. Yan lang po yung munang binibigay kong examples. Okay? Now, look at this class. This will be the trending of the pulse and this will be the trending class of your pulse pressure here also. Okay, so class, as you can see, tingnan nyo, yung difference nila could be seen here as your pulse pressure. So again, ano po yung purpose ng graph? Mas madali po nating nakikita, may problema. And it provides clinical decision supports through alerts, alarms, and protocol. Now, class, pag tumutunog ang alarm sa hospital, what's the best way to do it? Is it okay for me to silence the alarm right away? Is it okay na i-silence ko yung alarm right away? Yes? Hindi ko narinig. Ano daw? Hindi ko narinig. Okay lang ba, class, na for example, may narinig akong alarm? Sige, silent. Is that a good practice?
No, sir.
Okay? So, class, yan pong isang common error na nangyayari in the clinical setting. Once we hear the alarm, we have the tendency, class, to turn it off right away. But that's not how it should be. That's not how it should be. If you're turning off the alarm right away, class, you're missing something, okay, with regards to your patient. Or you're missing something regarding the setup of the machine that you are encountering. So before ka, class, mag-silent ng alarm, alamin mo muna kung bakit nag-a-alarm. Okay? Sige, we'll talk about more of that later on. And then other than that, class, your IT also provides access to vital patient information from any location. In the Philippine setting, class, this is still a goal. No? This is still a goal. Ano pong ibig sabihin natin dito ng from any location? For example, if I will be coming from the first district, okay, I would be able to convey the information right away to the city when I have a patient that I would need to endorse. Okay, so parang accessible siya anywhere. Pag ako naman yung doctor, for example, if I need to access the data of my patient and I am here at home, I will be able to do so by myself. Okay? And then, class, I would be able to comparatively evaluate patients for outcomes analysis. Now, bigyan natin ng example. Halimbawa, class, during this time of COVID, nakikita po ng mga doctors kung ano po yung mga simptomas ng severe COVID. Paano po nila nalaman that those are the symptoms of severe COVID? By comparing patients. By comparing patients. So nakikita nila sa system, ay okay, pagpababa ang O2 saturations ng patient, tapos halimbawa mataas pa yung D-dimer ng pasyente natin, the tendency is that magkaka-poor outcomes siya. Okay? Example lang to, class. So with that, they are able to conclude na, that will be the trend that we need to watch out for. Once we are seeing this trend, we need to aggressively treat our patients. Or once we are seeing this trend, we already need to talk to the family members so that we will be able to anticipate whatever worst is coming on the side of the patient. Okay, so that is done, class, by comparatively evaluating patients for outcomes analysis. Okay? Marami din tayong research, class, na gumagawa ng ganito. So there are already researchers, for example, that will be able to tell you, at the age of 80, okay, 80 years old, you are at 20% risk of dying on the OR table if you will undergo this procedure. Okay, as an example lang So class, ibig sabihin, statistics and research already allows us to predict the success of the surgery that will be done to the patient. Kung kaya minsan makikita niyo yung mga doctor sasabihin, ma'am, hindi na po tayo mag-ooperate sa patient because there is a 95% chance that she will not be able to recover from the surgery given her condition. So class, yung sinasabi na 95% chance na hindi po siya magre-recover is actually based on statistics. It's actually based on information systems. Hindi po yan haka-haka lang. Okay? Now, if you would look at this graph class that I have adopted from the internet, you can see class that there's a patient prior to treatment, and then class, there are processes that needs to be done. Then class, patient's experience and engagement. Along the way, class, there may be clinical defects that may happen, and then class, patient outcomes would occur. So ano pong ibig sabihin ng graph na to? In an information systems class, we are already able to see the entire picture of this, okay, in a particular information systems. Parang naka-map out na siya at saka parang mamomonitor na natin kung ano yung nangyayari sa pasyente. Now, let's talk about your physiological monitoring systems. Class, pag sinabi kong physiological, as the term implies, physiological, it refers to your physical. It refers to your physical. So this refers to vital signs. This refers to monitoring your current status as an individual. Now, if you would look at this, it's a very important part of history that we need to note that the physiological monitoring systems was not actually first invented for the hospital. It was actually first invented for your astronauts. So, anong purpose niya, class? It's to monitor what's happening in an astronaut when they are in space. In the same way, actually, di ba ngayon, class, marami na tayong simulation na ginagamit, no? It's wise for us to understand as nurses that simulation actually, class, did not start in the healthcare industry. Your simulation class actually started on the plane industry, as in class aeronautics. Okay? Plus, may imagine nyo, di ba, kung may driving tayo, di ba may driving lessons, nagpa-practice tayo ng driving using the cars from the driving school. So class, kung airplane, isipin nyo na lang kung airplane, tapos magpa-practice ka class sa actual na airplane right away. Pagkatapos hindi mo alam magmaneho ng isang airplane, the damages class would lead to millions and even billions class if lives would be involved. So ano pong nangyayari? Gumagawa po sila ng simulation, tulad ng mga games na nilalaro ninyo. So parang nagda-drive ka, pagkatapos parang mafe-feel mo that you are the pilot, you will be able to see what will happen and what will be the outcome of your flight. So ganun din po, may simulations po tayo in medical, so nanggaling po yan in the aeronautics industry. In the same way, class, that the physiological monitoring systems actually came from the astronauts. So ano pong ginagawa? Now, look at this image that I derived from the internet. If you would look at it, class, they use special wear. We call that, one example is your biomonitor. Your biomonitor class will be able to detect the following: the blood oxygen levels, the blood pressure, the heart rate class, and then the ECG of your patient, the temperature of your patient, the RR, the respiratory rate of your patient, and then the activity level of your patient. Okay, class, that's all embedded on a single suit. Okay, now, if you would look at it actually, there are available already, there are available systems like this even for us civilians and even for us private citizens. Di ba, class, kung nakikita ninyo, kahit yung mga smartphones natin, who among you here own smartphones that are able to detect pulses? Diba? Tapos class, may mga watch na tayo, yung mga electronic watch natin. So like your iWatch, you have your Samsung Galaxy Watch, or whatever watch there, class, you can notice that they are already able to detect your pulse rate, and even your activity. Diba? Pwede ka nilang i-prompt kung nag-exercise ka or hindi. So they are also physiological monitoring systems. But take note, class, that your smartphones and watch are less accurate. They are considered to be less accurate compared to the ones that are seen in the hospital setting. Okay? Baka sabihin nyo, may iWatch naman ako, hindi ko na kailangang pumunta ng hospital. Kaya naman ng iWatch ko mag-detect ng arrhythmia. So class, hindi. Kailangan mong pumunta ng hospital for the hospital to have the proper diagnostic test done to you. Okay? Now, there are 5 basic parts of your physiological systems. What are those 5 basic parts, class, of your physiological systems? One, dear students, is your sensors. Okay? By the way, may iba muna tayo. Pag sinabi ko, class, na physiological monitoring systems, one example of which is your ECG machine. Okay? As you can see here on the side, I've given an ECG machine as an example. Okay, class, this is an ECG machine. Ano po yung ginagawa ni ECG? Anybody muna who can tell me what is ECG? Sige nga. ECG. What organ yung chine-check ni ECG, my dear future nurses? Again? Okay, heart, no? Kasi nga, yung meaning ni ECG is electrocardiogram. Okay? One word yan, ha? Sinulat ko lang ng ganyan para makita nyo lang yung E, C, at saka G. Pero one word yan, future nurses. Now, plus your ECG machine is an example of a physiological system. In the hospital setting, plus a nurse may need to do ECG. Okay? Depending sa policy ninyo, ano? Kasi class sa hospital, meron din tayong tinatawag na heart station or meron tayong tinatawag na cardio department. So class, depending on your hospital policy, it may be your heart station or your cardio department who would do the ECG. Class, sino po yung tao sa cardio department? Nurses din po. Nurses din po ang usual na tao in the cardio department. Okay? Now, let's talk about the 5 basic physiological or parts of the physiological system. 1, sensors. Plus, if you would look at the diagram here, okay, let's label that as A. Ito po yung sensors natin, yung mga electrodes. Hanapin niyo po kung saan ko sinusulat ang letter A's. Okay? Plus, those are your sensors. These are your sensors. These are your electrodes. In other words, class, that's the part of the machine that will be able to sense what's happening on the body. Okay, so class, tinatawag po natin yung electrodes. Later on in MS, no, you will know that is your V1, that is your V2 here, this is your V3 electrode, this is your V4, this is your V5, and this is your V6. Okay, sir, ano yung mga VVV? Kaya reserve na natin yan sa MS, ha? Reserve na natin kay MS yan. So class, that's an example of your sensor. The next class is you have your signal conditioners. Class, pag sinabi nating signal conditioner, they amplify or filter the display device. Eh, ano pong ibig sabihin? They're the ones who amplify, no? Now, look at yourselves, no? Tingnan nyo yung katawan nyo. Makikita nyo ba yung electrical signal ng heart nyo? No. We know in anatomy that there's an electrical signal happening in our heart so that our heart would pump. But if I would look at my chest here, even now, I would not be able to see that signal. That signal, class, needs to be amplified para makita po ng mga mata natin. And that amplification is done by your signal conditioners. So class, signal conditioners, saan po yun? One example, class, is your paper recorder. Okay? One example is your monitor and your paper recorder. O, tingnan nyo yung monitor, may mga lines na siya. And then those lines, class, would make sense, no? Once you understand those lines, you would know that those lines refer to your P wave, QRS complex, ST, and then your U wave. Okay? Sige lang, class, as of this time, just think that you have your P, Q, R, S, T waves in your ECG. Okay? Pag marami kayong time, especially during the Valentines, try nyong alamin kung para sa ano yung P-wave, QRS, at saka T-wave. Ha? For the meantime, reserve muna natin ganyan. Reserve natin kay MS yan. Pagkatapos, class, there would be the filing. So, class, the filing will be able to rank and order the information. Class, saan po nangyayari yung filing? If you would look at these pictures that I have, that happens here inside the machine. Okay? Inside the machine. So, class, for example, yan yung ECG machine natin. After po natin ang procedure, pwede kong i-retrieve yan. Saan nga ba yung ECG ni patient Juan de la Cruz? Saan yung ECG ni patient De Los Santos? Pwede po nating tingnan yan dyan. Okay? Because it stores your ECG. But you need to be mindful, ano? You need to be mindful. Okay? Try to check the machine first. Does it really store? Okay? Does it really store the files? Kasi guys, may mga lumang machine pa sa hospital natin, ano? Na isang take lang ng ECG, ipiprint niya, tapos nakalimutan niya na. Okay? Parang mga ex nyo na mabilis mag-move on, di ba? Okay? Pero class, modern machines like this one being used in the hospital setting, they can already class store several. No? For example, I have seen ECG machines which could store 100 ECG readings and 300 ECG readings na rin. And then what do we do? Before you delete class, kasi come a time that you need to delete those information, you need to counter check first if all of them have already been backed up. Okay, you need to counter check that all of them have already been backed up. Okay? Sige. Now, punta tayo kay computer processor. Plus, computer processor would analyze data and direct the reports. Saan po si computer processor? Nang doon din po sa loob ng machine. Okay? Don't expect me to talk about the insides of the machine na ha. Okay? So class, nandoon yun sa loob ng machine. Siya po yung nag-a-analyze ng data at siya po yung nagdidirect ng report. Sir, anong report po yung kayang i-produce? Plus, if you have modern ECG machines, you know what? Your modern ECG machines, plus, could already have your pre-reading. Ano pong ibig sabihin natin ng pre-reading? Pwede nyo nang sabihin na, okay, ECG reveals sinus, bradycardia. Okay? Now, pag sinabi nating bradycardia, class, anong ibig sabihin? What happens to the heart? Is it moving fast or slow?
Slow, sir.
Slow siya, no? Slow. Okay? So class, that report in itself is already your evaluation and controlling. That's an example of your evaluation and controlling. Okay? For class, minsan, pag life-threatening siya, sasabihin ng machine class, possible MI. So class, MI is myocardial infarction. And when I say myocardial infarction, it is an impending heart attack. Okay? So class, kaya na po ng mga machines natin yan. The machine here that I place is the one commonly used already in the new hospitals here in our city. Okay? So, hindi na natin pwedeng sabihin na ay sa abroad lang yan. Plus, maraming bagay na nakikita natin abroad nang dito na rin sa settings natin. Kung kaya nga you are learning nursing informatics. Now, microprocessors. In our end as nurses, this is nice for us to know. Plus, microprocessors are embedded in the device that would process the physiological signals after they are amplified, conditioned, and digitized. In other words, class, microprocessors, yung keyword mo lang dyan is that it processes class, your physiological signals. Siya yung nagpa-process. So class, tulad ng picture dyan sa likod, that's a microprocessor. Okay, that's a microprocessor. So I don't know how they're doing that, but that very small device can actually interpret what's happening. It's the same device or the same thing that can compute in your calculators class when you are using your computers. It's the same thing also class that is able to interpret what's happening to our patient physiologically. And the microprocessors class will be able to alert the nursing personnel through a report plus an alarm or a visual notice. Okay, so yan po yung mga way magre-report, mag-a-alarm, or hindi po kayo mag-visual notice. Now, plus take note that your physiological monitors would have several purposes. Isang purpose po ng monitors is to incorporate both arrhythmia and hemodynamic monitoring capabilities. Now, ano pong ibig sabihin natin yan, class? Pag sinabi natin class arrhythmia, ibig sabihin there is abnormal rhythm. Okay, class, pag sinabi kong arrhythmia, there is abnormal rhythm, especially that of your heart. Okay? Kung kaya class arrhythmia. Okay? Now, so paano po na i-incorporate yan? Usually guys, your heart is when your heart class is beating, it would have the PQRST that I have mentioned. So class, this is your P, this is your Q, R, S, and this is your T and U. Okay? So again, class, medyo okay, that's how it looks like. Okay? Later on, you will understand more of that in MS. Pero gusto ko lang magbigay ng example ng arrhythmia. Class, isang example po ng arrhythmia, isang tinatawag nating VTAC. Pag nakikita mo po yung pasyenteng may VTAC, yan po yung pagmumukha ng ECG niya. Okay? Compared to this one, this is the normal. This one class is an example of VTAC. Pag VTAC po, that's a life-threatening arrhythmia. Your patient is in an emergency and your patient class might rest in peace any minute from now. Kaya pwedeng mamatay yung pasyente mo any minute from now. So pag nakikita mo yan sa cardiac monitor, huwag kang patunganga and then, uy, ang ganda tingnan. Anong gagawin natin dyan? So class, right away call for the physician. Right away check for the pulse of the patient because your patient might actually already be needing CPR. Okay? Now, ano naman class yung mga hemodynamic monitoring? Class, pag sinabi po nating hemodynamics, it talks about our physiology. So this refers to your vital signs, nandyan yung vital signs. Pagkatapos class, nakikita mo even your mean arterial pressure, nakikita po natin yung O2 sac, other cardiac monitors will be able to show the the carbon dioxide levels in the body. Okay? So class, later on, if you are already in your respective hospitals, try to look at the ECG. Tapos alamin mo, ano nga ba itong 54 na to? Okay? So class, with my experience, I'm able to say that that's the heart rate. Ano nga ba yung mga lines na to? So class, that's an ECG. But take note, not all lines that you can see in the cardiac monitor is an ECG. There are capnograph there, plus the capnograph also looks like this one. Okay, when I say class capnograph, the purpose of your capnograph is to monitor arterial blood gases. Okay? O baka makita mo tsaka magpanik ka, hala, sabi ni Sir VTAC yan. Okay, sabi ni Sir VTAC yan. Oo, class VTAC yan kung sa ECG. Pero pag yan po ay arterial blood gases, capnograph po yan, capnograph. Carbon dioxide yung minomonitor niyan. Okay? So what am I telling you? No? We are orienting you on these machines, but once you are in your hospital setting, you always ask, you always read for you to try to find out if what are the parameters indicated in your machine. And actually, class, no? In more modern machines, you can actually change the parameters indicated there. So, halimbawa, pwede ako magdagdag dito, pwede ako maglagay ng O2 saturations here, pwede ako maglagay ng pulse pressure dito. That's in modern machines. No? So, meaning, whatever is closely monitored to your patient, you can set up the monitor so that it will be the information that will be visible in the monitor of your patients. Okay? Now, there are more machines in the hospital that we need to know and that we need to see. I will be discussing that in the next topics na.